Next, we're going to talk a little more specific about what your treatments were, what the side effects were, what your memories are of those.
So my main treatment was chemotherapy. I had cisplatin for my chemotherapy agent. And I had a couple of debulking surgeries as well. They went in and tried to remove the main tumors. But in between those surgeries, it was chemotherapy. And when I went through chemotherapy, it's before Zofran and anti-nausea medication. And so from my experience, most of that year was spent in the hospital just vomiting because the chemotherapy just made you vomit. And so I didn't really eat for that period of time. All my nutrition was through TPNs or lipids infusions. And so I remember just losing a lot of weight, a lot of muscle, a lot of coordination and balance. When I would finish treatment, a lot of my therapy was just trying to rehab my body and trying to learn how to walk and function and move around and not having the nerve sensations to actually hold objects and those things too. So there's a lot of kind of long-term effects that occurred just from that year of me being in the hospital.
I remember while seeing an image of the actual tumor from photos that my dad had on his phone. I saw an actual image, and then later we realized that I actually fainted from seeing that image. So then my parents helped me get back to being normal after fainting. And then the image I remember seeing from a picture is like a tube going from me to a machine that like do something with the blood and like re-synchronize it and get it back to how the blood that should be in me be like. I remember seeing that image too. And then when I saw that, I looked at my own face just because I was I just literally realized how much I was probably crying about it. Like now, I have some less control over this arm, but still a lot of control. It's just like a little off. And my right eye actually twitched. And then it gave me a type of seizure I had before, but now it just gave me episodes that actually make me like paralyzed and all that now. And the last seizures, I just like go out of control.
So mine was an actual tumor in my left femur. And so I started with 3 months of chemo, I think, to stop the growth or stop any growth anywhere else in my body. And then I actually had a femur, knee, and part of my tibia replaced. So they took out all of the bone plus my knee, and I have actually a metal prosthesis now internally. So they were able to save my leg, which is awesome because of where the tumor was located. And then once I healed from that, then I had 7 more months of chemotherapy. So I had the same cisplatin, which is what made me the most sick, I think. A lot of vomiting with that one. The other one is methotrexate I had. And methotrexate was hard because it was probably the most frequent one, but it also caused a lot of blisters. So at one point, I know the bottoms of my feet were just covered with blisters, and I got some sores and blisters in my throat. And so that is probably the most vivid memory that I have. The most painful memory that I have was, not being able to really eat or drink anything, and having to deal with the pain of that.
So when he was first diagnosed, they got him in right away and started chemotherapy within a week, and his entire treatment plan was chemotherapy. The first year of therapy was very intense with a lot of different chemos, and most of them caused him to be completely immunocompromised, where his ANC was extremely low and he was not able to leave the house or go to school or things like that. So the entire first year was kind of like that. Immediate side effects would be the nausea and extreme fatigue. And he actually had a pretty severe peripheral neuropathy due to mainly one of the chemotherapies, where the strength of his ankles were very weak, and he lost some feeling in the tips of his fingers and toes. I think his legs in general were just a little more tense, where he didn't have the movement that was supposed to be there. And even out of treatment right now, he is still kind of dealing with the after effects of the neuropathy and strengthening his ankles. He is being evaluated for a neuropsychology and checking some of those functions. We are seeing some difficulties with executive functioning right now. He's a very intelligent kid, but we're seeing some of those planning and time management and those kinds of things. It's not clicking for him, and it's a pretty common thing to deal with afterwards.